Over the past 15 years, research on cognitive and neurological disorders has provided us important new information which helps us understand more about the effects of hearing loss than ever before. This research has taught us four things. Number one, the effects of common hearing loss are much more complex than previously believed. Number two, hearing loss is not just a disorder of the hearing organ. Number three, it has become clear that progressive hearing loss causes a gradual breakdown of the brain's neural network, which is responsible for our ability to easily understand what people are saying in almost all circumstances and communicate in those circumstances. And number four, what has been suspected for many years, but hasn't been clear until now, is that the level of recovery from the overall effects of hearing loss that a hearing aid user can expect does not depend just on the brand and advanced features of hearing aids. Hello, my name is Thomas Reed. The purpose of hearing aids is to restore your range of hearing when you are wearing them. Many brands of hearing aids can do that. Conventional hearing aid dispenser services are based on adjusting hearing aids to reach the following goal: to improve your range of hearing to the level that allows you to recognize more words and sounds that you were no longer able to naturally hear. The justification for that rationale has been that if you can hear better, you will improve even more on your own. Hearing aids were never designed to guarantee improved understanding. This method represented the most effective results that professionals could achieve during a period when technology was primitive and very little was known about the neuroscience related to learning, memory, cognitive functions, and how the brain reacts to any information getting into it, especially sound. Now that so much more is known in these areas, the goal I mentioned is no longer considered current or valid. In fact, it is primitive in terms of what is known and used in most every major medical treatment today. Neurova is a protocol which catches hearing care up to the levels routinely used in other medical treatments. It is a neuroscientific and medically based recovery process. A Neurova hearing care professional will not only improve your hearing, but will significantly improve your ability to stay in the flow of conversation in day-to-day circumstances and improve your communication effectiveness. This treatment system incorporates a fully personalized neuroscientifically based amplification method and medically based therapeutic process to reverse the gradual breakdown of the brain's language processing network, which hearing loss causes to occur. There is no question that hearing care professionals can improve a person's ability to detect sound with hearing aids and understand words more easily. But almost everyone who uses hearing aids agrees that even with excellent hearing aids, their difficulties are not resolved by the adjustments made to the hearing aids. Why these difficulties are not automatically solved by the use of hearing aids has been the subject of years of intense research. Keeping up with flowing conversations, understanding more effectively in day-to-day circumstances, and communicating more effectively are examples of the concerns that persons with hearing aids continue to report. Studies now confirm that routine hearing aid dispensing services do not take into consideration the deeper issues known to occur in the brain's neural network. This goes to the heart of the problems that most people with hearing loss have had to endure. But the same can be said for stroke patients 20 years ago and for virtually anyone whose medical conditions have been beyond the reach of medical knowledge and treatment of a particular time. Thankfully, that's no longer the case for persons with hearing loss. Even still, here is why this treatment has taken so long to develop. There are two reasons. The investigation leading to the development of Neurova could not even have begun until around 2000. This was when hearing aid technology had finally advanced to the degree that research could be based on far more accurate and precise levels of amplification that were necessary to objectively correct a person's dynamic range of hearing. This was a major development in the hearing aid industry. By the year 2000, medical research in neuroscience, genetics, biochemistry, learning, and memory had advanced to the degree that we could understand important new details about the steps that could be taken to reverse the neurological impact of hearing loss. From his research in genetics and biochemistry, Dr. Eric Kandel discovered what is necessary to trigger our DNA to create connections between the neurons. This brought the world closer to understanding how learning and memory are created and structured in the brain. This shed new light on how language is developed and maintained throughout our lives. For his work, he received the Nobel Award in Medicine in 2000. This gave our independent research group, the Health Education and Research Center, the framework for developing an advanced treatment for persons with hearing loss. Our scientific reviews confirmed that if any treatment could be developed, it would have to be based on the principles of genetics, neuroscience, and biochemistry. If not, any future developments would not be compatible with the principles on which our language was developed and maintained. Any valuable and superior treatment would need to be based on more of these sciences than just on how to make listening and hearing more comfortable, which has been the main goal of hearing aid developers for the last 70 years. Our group realized that it was time to merge medical science with hearing aid services. So we established a dynamic new set of ground rules for the hearing care professional to adopt and provide to the hearing loss patient. Hearing is not a skill. We don't have to learn how to hear, but we do have to learn the language that everyone around us uses. We can all agree that language is a complicated skill. It takes years to develop. So language is a skill. What is one thing we know about all skills? If we don't use them, we lose them. It's obvious. Pick any skill you've learned and use less and less over time. Here's how that works in the brain. Neurons communicate with other neurons through connections. The connections are called synapses. When we participate in structured education and training to learn language, music, or any other skill, the learning process causes millions of new connections between neurons to be created. The more we learn, the more these connections are created to make us faster and better at that skill. But that only happens if we pay close attention and practice. Paying attention to a subject, concentrating, and practicing are necessary to convince the brain that we're going to use that information more than any other information that gets into the brain. That's why you can't tell me right now how many clouds you saw in the sky yesterday, or how many birds you heard singing in your backyard. You didn't pay attention to them or concentrate on them because knowing all of those facts wasn't important to you. So the brain creates a process to make important information quickly available to us. And once we've learned, using a skill such as language is what keeps those connections healthy, stable, and in proper working order. Think about your muscles. You train them in exercise programs. Then you use them. Using them keeps them in healthy working order. Not using them causes them to get weaker. It's the same principle. But when we use a skill less and less over a period of time, we convince our brain that our old skill is not important enough for it to keep those connections healthy, stable, and in proper working order. This is important if you need to understand what hearing loss causes to happen in your brain. When you cannot hear particular sounds like you used to, the connections get weaker and weaker and can disappear entirely because they're not being used. Weak and non-existent connections make it impossible to tap into the language network in your brain, which allows you to understand in all types of circumstances, just like you were able to understand before you developed hearing loss. When particular sounds cannot get to the brain, you begin to use other skills to try to understand. What is most important? Understanding and communicating. You begin learning, concentrating, and paying attention to how to keep up with ongoing communication despite not hearing particular sounds. You create an entirely new method of staying in the flow of conversation. Those sounds that you used to hear become irrelevant. Why? It's because they no longer are within your range of hearing and they just aren't working anymore for you. Whether you stop using a language or you can't hear it, the results are the same as far as the brain is concerned. The connections become the source of your problems, and under the right conditions, the basis for the solutions to your problems. Why? Under certain conditions, those connections, called synapses, can be restored to health or rebuilt. This is life-changing news if you have hearing loss. We discovered that amplified sound does not restore those connections as we'd hoped. When the new or renewed sound can enter the brain again, it is not presented to the brain under the same conditions that are known to trigger the brain to build or rebuild the connections which make it faster and easier to understand language. Unless you are treated with Neurova, there is no other way to reintegrate those particular sounds in the same way they were structured before hearing loss changed them. This is why people with hearing aids still have problems with understanding and communicating. We also discovered exactly how to rebuild those connections. Here's how Neurova does that. Our trained professionals apply medically valid procedures. Our dynamic technologies allow instant adjustments to your treatment protocols if your hearing loss or any other risk factor changes. Your treatment begins and ends as a fully tailored process. Most important, you only need to go through Neurova treatment one time in your life. After that, everyday sounds will keep those connections healthy, stable, and in proper order. And most important, we know what is occurring in your brain at each step. We are not in the dark, just hoping that you will recover on your own. We manage this process from beginning to end. Becoming a Neurova patient starts with a patient history form and standard tests. The steps are very similar to what you experience if you receive cardiac care, orthopedic care, or virtually any other major medical treatment. Thanks to a world-class team of computer programmers, we transformed a very complex manual procedure, which we performed in our trials, into a streamlined process that makes every step easy for you and for the specialist who takes care of you. The steps are simple and take almost no more time in the clinic than traditional dispensing takes. If your health or your medical status changes, we can instantly recalculate how to adjust your treatment plan based on those changes. Hearing aids alone will never be able to do that. So what do you need to do? First, you fill out a patient history form and have your hearing evaluated. If you don't already have hearing aids and they become necessary, take your professional's recommendation about the ones which are best able to meet your needs. At that point, tell your professional to help you enroll in the Neurova therapeutic process. Because of these technologies, your provider will be able to help you achieve what otherwise would be impossible to achieve. Then, just follow your therapeutic instructions. Recovery is right around the corner. The patient history form and evaluations identify the factors needed to tailor a treatment just for you. Our rationale for amplification is based on the principles of neuroscience and biochemistry. We increase the dynamic range of your hearing based on the same objectives used by orthopedic surgeons who increase the dynamic range of motion for an artificial hip patient, or the cardiologist uses who increases the dynamic range of a patient's cardiac output. Our therapeutic library contains 5,000 words which are categorized by all of the frequencies in the dynamic range of human hearing. Based on your personal history and risk factors, we match your specific therapeutic and amplification requirements to the exact words necessary to restore and rebuild these connections. The content in each therapeutic session will be made up of the exact frequencies in the words that you need at each level in your therapy to progressively restore and rebuild your neural network. You can see how you play a role in your own recovery now. You only need to dedicate between 5 and 10 minutes 1 hour before bedtime to take your main therapeutic exercises. Why before bedtime? It's because much of the protein building that occurs in the brain and the body goes on at night while you are asleep. After you've gone through your main exercises, TheraFit identifies the words you may need more help with. An optional list will be provided to you at any time throughout the day so that you can take supplemental exercises. Once you have gone through the first stage, which is 12 weeks in length, you will be able to progress faster and faster. TheraFit has 26 levels of therapeutics so that you can develop as far as is possible for you to develop. Your therapy will be more fun and a little easier if a companion can be with you at least during the first stage of your exercises. That person will also play an active role in helping you recover by following the exercises on the computer and helping while you are repeating them. But if you don't have a companion, don't worry, you will recover just as much. Almost any computer with speakers will work as long as you have an internet connection. You are provided with a very simple sound meter to make sure that the location you prefer for your therapy will follow our acceptable noise level guidelines. We also have an ongoing professional role. We monitor your progress and your difficulties every step of the way. We will make changes in the therapeutic process based on your progress. We provide comprehensive support during the 3 to 6 months that it takes for the brain to do its work. You are not alone. All 4 levels of the Neurova treatment allow you to retrain your brain to more effectively recognize auditory information, rebuild your neural network to increase the speed of understanding and communication, and recover the quality of life that hearing loss had begun to take away. If you think this is a harmless problem that can wait until it gets worse, you need to consider this information. Alarming research is now being reported by major universities. These reports show that if your hearing loss is left untreated, it greatly increases the risk of life-threatening conditions such as dementia, Alzheimer's disease, heart condition, and even stroke. So I strongly encourage you to do something about this, especially now because the first valid medically based treatment for hearing loss is finally available for you. But if you need more information, you will find it on our website. The one thing you may notice is that we have not placed any importance on the brand or the model of hearing aids on the market today. There are many high-quality brands of hearing aids. Take the advice of your hearing care professional about how to select your hearing aids. The most important considerations are manageability, clarity, fidelity, and durability. Keep in mind that everyone you love, work with, or have anything to do with on a regular basis already knows you have hearing loss. If you insist on anything, insist on a set of hearing aids that are easy to insert and remove and adjust when necessary. We wish you a speedy and full recovery on your journey to better hearing, healing, and more effective understanding of what you hear. I can't think of a better time than right now for you to tell your professional provider that you are ready to recover from the impacts of hearing loss in your life. Enrolling is easy. The therapy is simple. Improvement is just around the corner. Don't let hearing loss rob you of the quality of life it has taken a lifetime for you to build. Enroll in Neurova today.